Good morning, everyone, and welcome to today's webinar. We'll give it a few minutes as we watch the numbers and people register. We should be starting in the next few seconds. Right, I think we have reached critical mass, and I'll go ahead and start the webinar. Again, welcome to today's webinar titled Vaccine Safety, Side Effects, and Adverse Events. My name is Sibusiso Tlechwago. I'm a Director of External Affairs Africa Region for PATH based in Johannesburg. Welcome to the webinar. I must mention that even people in the medical field, it is not easy to use the term, or it's easy to use the term side events and adverse events interchangeably, yet they do not have the same meaning. This webinar will serve to shed more light on such issues. It is a webinar that's convened by the South African Health Products Regulatory Authority, SAHPRA. And the purpose of the webinar is to provide a platform for a dialogue and information sharing to enhance the public's understanding on medicines and medical products, side effects, and adverse events following immunization. All medicines, including vaccines, can cause side events. In the case of vaccines, side events or adverse effects that occur after vaccination administration as adverse events following immunization. And adverse events following immunization is an untoward medical event which follows immunization and does not necessarily have a causal relationship with the administration of the vaccine. Unfortunately, we've encountered a lot of information on adverse events following immunizations, and in some instances, it is information that is incorrect and has unfortunately influenced people to not get vaccinated in some instances, and thus delaying the country's progress towards reaching the target of 70% COVID-19 vaccinations. With a positivity rate that is still over 5%, it is safe to say that the pandemic is not yet under control for South Africa. To date, less than half the adult population is vaccinated, and there are a variety of factors that contribute to the low uptake of vaccines, including information or misinformation on adverse events following immunizations. That will be addressed during this webinar. We expect that at the end of the webinar, we'll have a public that's more informed on the role of SAHPRA in ensuring vaccine safety. We'll also hope that we'll have improved understanding, particularly by participants of this webinar, on the differences between side effects and adverse events. We've got a very interesting panel that's going to be part of this, or that's part of this webinar. We've got the CEO of SAHPRA, we've got Dr. Boitumelo Semeta, we've got Ms. Flora Matlala, she's the Manager of Pharmacovigilance at SAHPRA, we've got Professor Mark Blockman, the Chair of SAHPRA's Pharmacovigilance Advisory Committee. We also have Professor Hannes Meyer, the NISAC Committee Chairperson. There are also other aspects that have joined this webinar, including some from the Department of Health and SAHPRA, and amongst them is Marion Skonfeld, who is the Pharmaceutical Policy Specialist at the National Department of Health. We'll go through the presentations, and we have got a chat box where we expect that you will be making questions which will be collated and channeled to the different speakers, and they will be asked at the end of the presentations during the discussion session. With that being said, I'll welcome Dr. Boitumelo to give us some welcome remarks from SAHPRA. Over to you.
Thank you so much, Sibusiso. We'd like to welcome the public, and we hope that this webinar will go a long way to educating the public and providing a lot of information and detail on vaccine adverse events. We have received as SAHPRA a number of questions following a publication in the media indicating some adverse events regarding the Pfizer vaccine. And so we will again, touch on this and may help the public to understand what this report means. Thank you so much, Spusiso.
Right. Thank you so much, Dr. Waitumelo. I think at this point, we'll then get our first panelist, which is Ms. Flora Matlala. She'll be giving an overview of Pharmacovigilance Med Safety App and adverse events following immunization and microsite. Over to you, Flora.
Okay, good morning, everyone. My name is Flora, and I'm the Pharmacovigilance Unit Manager at SAHPRA. And today I'll be sharing with you the pharmacovigilance overview. I just want to change my slide here so that it can be more visible.
Go to display setting.
Okay.
Display setting.
Yeah. Okay, I'm gonna do this because now okay, I'm battling to see the display setting, but maybe what I can do then is just to have one screen on and hope that all will be well. Is it still showing two?
Okay, now we see one slide, thank you.
Okay, all right. So, okay, I'll just go back and then open this properly. Okay, good morning, everyone. My name is Flora. I'm the Pharmacovigilance Unit at Sabra. So in today's webinar, what I will be doing, I'm going to be sharing an overview about pharmacovigilance, and I'm going to be very simple so that I provide an understanding to the public to understand what is pharmacovigilance, and in pharmacovigilance, what we're responsible for. So I've decided to start with the definition of pharmacovigilance, and so that we can have a broad understanding of what we mean when we talk about pharmacovigilance. So according to WHO, pharmacovigilance, we refer to it as the science and activities which are relating to detection, to assessment, understanding and prevention of suspected adverse events or any other drug-related problem. Then I decided to go into deeper details to say what we mean by detection so that people can have an understanding of what we mean when we talk of detection. So detection, basically, we're talking of identification of medicine safety related issues. And these are some of the things that maybe have been indicated in the publications that are making rounds on the public media. And this, we refer to them as signals. And then furthermore, we do assessment. So when we do assessment, what are we doing? We're looking at what we have identified under detection, and we do research on what has been identified with regards to the safety issues that have been reported, so that we have a better understanding of this safety issues that have been identified. So in understanding, we're looking at the mechanisms of action. How does this take place? Is it biologically plausible for this to take place? What are the risk factors? Who's at risk of developing an identified signal? Who are the vulnerable groups in this instance? And then what are the trends with regards to what has been identified or detected as we do pharmacovigilance? Then once we have an understanding, then we come with what we call risk mitigation strategies. And with risk mitigation strategies, basically, we are trying to minimize the risk or even eliminate the risk if possible. And then on top of that, we do education and training, and that will be for the public, for healthcare professionals, and all pharmacovigilance stakeholders. Then we do communication, and we also do reporting. And reporting, we're talking reporting of adverse events. Once we have identified after taking a medication, and that's how we do our prevention. So the process itself, it's actually underlined in the part below where we talk of collection. Collection is where now the public would be reporting adverse events. following immunization or following taking any medication. And then within the unit, we do what we call collation, and I will talk to what we mean when we talk to collation. Then we do analysis of this information that comes through. We do the assessment, and then that's where now we detect signals and we communicate anything then that we may have identified in terms of change in with regards to change in risk-benefit balance, and this would lead to prevention of adverse drug reaction. And this is a continuous cycle. It doesn't stop. So this is what we mean when we are referring to pharmacovigilance. So I thought before I can actually indicate the reasons why it's important to do pharmacovigilance, I should brought some kind of idea, practical examples of what's happening with regards to adverse drug reaction or adverse events following immunization that have been seen around the world. So the first one, adverse drug reactions are responsible for about 100,000 deaths per year in the USA, and that's according to Larazzo, and it's been highlighted as the 4th highest cause of mortality in the USA. Then secondly, in every 1,000 medication orders, there's about 4 medication errors that are identified, and this is according to Institution of Medicines. Then medication errors or adverse events are also identified in 50% of every surgical procedure, and that's according to Mass General Hospital. And then lastly, in South Africa, approximately about 6 to 8% of all admissions are as a result of adverse drug reaction. And we're talking excluding overdoses of drugs, drug abuse-related reactions, and medication errors. So I thought I should at least shock you a little so that you understand the importance of pharmacovigilance, why it's very important so that pharmacovigilance can be done. So why the need for pharmacovigilance after I have shocked you? What are the goals? What are we aiming to achieve with pharmacovigilance? Firstly, we are aiming to identify adverse events. So that's the reason why. And I think as I was explaining the definition of pharmacovigilance, I indicated the need for us to identify the safety signals, and those they are as a result of adverse events. So we're identifying adverse events. Secondly, we need to enhance patient safety and care in relation to the use of medicine. So it's very important that the public understand what is this medication, what am I taking, and then what are the possible adverse events that maybe can follow after taking this particular medication. Thirdly, we need to identify the risks that are associated with the use of these medicines. Then furthermore, we need to improve public health as a whole and safety in relation to the use of medicines, and promote awareness in terms of providing education, being available so that the people can be aware of the adverse events, what are the routes that they can use to report, and what happens to this data. So it's more about promoting awareness among the patients and general public regarding the rational use of medicines. And lastly, to promote safe, effective, and rational use of medicines. So when we talk of rational use of medicines, we're basically referring to the correct use of medicines. So these are the reasons why it's important to actually do pharmacovigilance. So I thought I should also say, how are we doing this pharmacovigilance in South Africa? What are the processes that are involved with regards to reporting adverse events following immunization or following any other medication that one may be taking? Then on my left-hand side, we've got what we call reporters, and reporters are basically consumers, consisting of healthcare professionals and consumers. And these are the people that are very important in the process of pharmacovigilance, because without a patient, we will not be aware of adverse events that may have not been identified during clinical trials. So once a patient has taken a medication, then they identify anything that is untoward following the administration of this medication. Then they need to report or inform their healthcare professionals, who must report on their behalf. Be aware that it's anything untoward. It doesn't necessarily mean that it is related to this particular product, but it's anything that you identify that after I've taken this medication, maybe I have identified this and I need to report. So what are our reporting systems that are in place? We have the paper-based form, and the paper-based forms, basically, they are available on the SAHPRA website. You can go to any clinic or any hospital or any pharmacy. They will have access to our website where they can download this. However, we discourage the use of the paper because it's actually taking time. Then we've got 2 electronic systems, and that's e-reporting system. It's available on the SAHPRA website. If you go on the SAHPRA website, you will see the e-reporting. Furthermore, we've got what we call the MedSafety app, and this app is available on both the Android and the iOS phones. You can download it. And once you have done that, you complete the report on your phone or even electronically on your laptop, and you submit them directly to SAHPRA. So the paper-based will go via provinces, and then from the provinces, they have access to our system, which we call the Vigilance Hub, where these reports will end up with SAHPRA at the end. Furthermore, other patients, they decide to report directly to pharmaceutical companies. Then the pharmaceutical companies on my right-hand side, they will receive this information from either healthcare professionals or the public as well. And then all this, then they will send to us in different formats. Remember, if you are going to be using a MedSafety app or e-reporting, or you are going directly to a healthcare professionals, there is no need to continue to be telling the pharmaceutical company again about your adverse event, or if you do, make them aware that this has been reported, because what happens is that all these reports, they come to SAHPRA under the single system. So if you are going to report more than once, then you are going to be duplicating the system, and we will see that there will be a number of events that have been heightened as a result of just duplication, not because there's actually an existence of this in the real truth. So once we have all these reports in the system, then we are going to assess them, all the process that I have indicated to you. This is where now the collation comes. They are collated at a single point. This is where we go in to do the assessment. This is where we go in to do the signal detection, identify if there's any untoward events that maybe we're seeing that needs further investigations, and then we do investigations. That's where we do causality assessment. And then once all this information we have, we contribute into the what we call the WHO Global ICSR database. So we send all our reports to the global database. And the importance of us sharing this information with the global database is so that we can contribute to the greater safety of the medicine in globally. So all countries, what they do exactly the same. They take all their safety information and they put them under the ICR database, the VG base. And this is where now we've got big data, and this is where you are seeing more information, because now it's coming from different countries, and this assists us to understand any relations with the product, if there's any, and then what are we seeing. This is where we're identifying signals even much better because of the bigger data. So remember, when you are taking a medication and then you're experiencing anything, it's important to realize that this has a greater impact, because it doesn't only end with SAHPRA, but actually you're contributing to the safer community for the whole world. Okay, so how do we improve reporting? So SAHPRA has launched what we call the MedSafety app. And the MedSafety app, basically, it was launched in April 2021 so that we can improve reporting, because we had other systems. However, they were not that effective. Then we realized there's a need for us to bring reporting at home in the comfort of the public. Then we launched the MedSafety app. And then this MedSafety app basically is designed to simplify and promote the reporting of adverse events. And when I talk of adverse events, I'm talking adverse drug reactions and adverse events following immunization. And furthermore, we need to address underreporting. If we are not reporting what we're experiencing after we have taken medication, then it results with what we call underreporting. And we are unable to identify any untoward occurrences, the signals that needs to be investigated, then we won't be able to do investigation as we should, and then come with mitigation strategies that we need to put in place. So your report is very important so that we promote reporting and safer use of medicines in general. And then we promote pharmacovigilance locally through the use of the MedSafety app. We strengthen spontaneous reporting of adverse events, and it replaces the paper format, as I've indicated, that it's actually labor intensive. compared to the app. The app directly fits into our system. There's no need for manual capturing. All we will do is maybe to do a follow-up with regards to certain information that may not be available at that point in time. And what's important about the app is that it strengthens quality because it prompts you to say, these are the kind of questions that we need to respond to, and then these are the kind of answers. And then I've provided a link as well at the bottom where you can access our MedSafety app. In the interest of time, I would not be going there. However, if you go on the SAHPRA website, you will be able to have access to that. Furthermore, there's more benefits with regards to the use of the MedSafety app as highlighted on the right-hand side, where you are able to create the watch list of the medication that you are interested in. Maybe it's something that your mom is taking, maybe it's something that you are taking yourself. Then you are able to actually monitor the safety of that particular product, the risk-benefit profile of that product, how is it performing? So there's a number of benefits that are related to the use of MedSafety app. So we promote the use of MedSafety app for all the highlighted reasons that I've indicated. Then lastly, on my presentation, I want to share with you the Sabra microsite. And the Sabra microsite, basically, after all the reports have been collated in a single system that I've indicated earlier, then we have developed a Sabra microsite where we are sharing all the information, particularly at this point in time because of the COVID-19 pandemic, because of the rollout of the COVID-19 vaccines, because of all the safety concerns surrounding the COVID-19 vaccines. Then we thought it's of importance that we become transparent and share the safety information related to the vaccines, what we have received, what has been received from the public. Then it's important that we share with the public. So if you go on our website, you will be able to access this information and you will be able to see all this information that is highlighted on the right. I will not be going to this because it will also take much of the time. I've done more presentations of this, but should you be interested, please do visit our site. And this is where you're going to get more information, particularly pertaining to adverse events following immunization. And in conclusion, I would like to say medicine safety is a collaborative effort by all stakeholders involved. And when we talk of all stakeholders involved, we are talking from the consumers, the patients themselves, the healthcare professionals, the district, the institutions, whether it's hospital, whether it's clinic, whether it's an individual pharmacy, whether it's a medical doctor on the other hand. So all of us, if we work together as a team, then we are going to make a greater contribution towards the safety surrounding the medication, and we are going to promote the rational use of drugs in general. And in so saying, I would like to say thank you very much for listening, and I hope that you have realized the importance of pharmacovigilance in general. Thank you.
All right, thank you so much, Flora, for speaking, giving an overview of the MedSafety app and also the microsite. And of course, it has got very useful information. And then the next speaker is going to be Prof. Mark Blockman. He's the chair of SAHPRA's Pharmacovigilance Committee, and he'll speak to SAHPRA's pharmacovigilance process, risk, benefit, and side effect reporting, risk management plan, and critical and technical requirements for safety and clinical efficacy. Over to you, Prof. Mark.
Good morning, everybody. I'm just going to share my screen. Thank you for the introduction. So good morning, everybody. I'm just going to give a brief message around some of the work that is done in terms of the safety review of the vaccines and the processes around that, and then we'll leave the rest up to questions afterwards. And so just to remind everybody what the task and SAHPRA's mandate is, it's around obviously monitoring, evaluating, investigating, and then registering and approving all health products. And importantly, there are three pillars which one looks at to try and protect the well-being of our patient population and our public. And I've highlighted safety, but obviously efficacy and quality are very important. And this is around the safety aspects of, and in this case, of the vaccines. Just to remind everybody that what vigilance means and what it's all about. And it's within the regulation that vigilance must occur and around medicines within its whole lifestyle. And so in terms of the life cycle, one must start at the data, the preclinical data, the data that's put in front of the regulator. And then after the fact, one must continue to look and monitor to see what is occurring with either in the literature or what is reported, and an ongoing analysis of the risk benefit. And as you can see, this looks at signals of new or previously understood adverse events. One looks at the monitoring of the risk-benefit profile, understanding the risks over time, because one can't always understand all the risks in the early phase studies and what's put in front of the regulator early on in terms of the approval cycle, looking at new risk factors for known adverse events. Are we able to redelineate those risk factors, better understand them, and look to maybe contraindicate them in certain populations? And then ongoing review of reporting rates, making sure that we are getting as many reports as we can to be able to continue the risk-benefit assessment in its life cycle. So I've put here that the COVID-19 vaccine is critical for the disease mitigation going forward. People say it's a game changer. I'm suggesting it's very important aspect of the armamentarium for the management of the pandemic and as we move forward. So what is the process of the vaccine review? And there's a robust review of safety and efficacy data. And that's, we have the published and unpublished data, which is very important. Sometimes only the published data is available in obviously on the internet, and we are able to see the unpublished data as well. And we also look at the safety trials, the ongoing safety trials, which then get put back into the system to review, to get a better elucidation, better understanding of the efficacy and the safety of the vaccine as it moves into the population. We also note the approval and decisions by other regulatory authorities. It's a collaboration. So, for example, the EMA or the FDA, we note what reviews they've done. We note some of the decisions and maybe some of their thought processes on risk or efficacy, and we add them into our review process to make sure that we are up to date and we've scrutinized as best as possible all the data. And then there's the approval, and importantly, what comes with the approval is the vigilance conditions. So once the medicine is approved, it's not just off you go and use it. There are strict criteria in terms of those vigilance conditions, which are provided early on in our presentation from a regulatory point of view. So what are some of those safety strategies as we move forward? Well, there's ongoing review of safety data from clinical trials, because remember, in the life cycle, there's the initial early clinical trials, the more robust in the patient population to give us some of the efficacy and safety data, and then ongoing clinical trials to better elucidate around efficacy and safety, and maybe in some different populations to give us a more holistic view of a medicine, or in this situation, the vaccine. We continue to make sure that there's acceptable quality, and then obviously there's some licensing conditions which may be imposed, which makes sure that the manufacturer is accountable to the safety monitoring. So what are some of those? Well, one is the risk management plan, and the idea of the risk management plan is to do a few things. So once you've reviewed the dossier and you've come up with an understanding that this is efficacious, and at the moment the risk benefit is in favor of benefit, then there's an approval process with some vigilance requirements, and that's the idea is to have a recipe of what that looks like. And this is the risk management plan. And what it does is it identifies the way forward of how the manufacturer will be looking at safety and reporting on safety. What else it does is it looks at where the gaps are Importantly, in all medicine approvals, there are gaps, either in certain populations, maybe better understanding some of the safety signals. And these gaps are filled in with an accountability from the manufacturer within the risk management plan. And obviously, there's obviously reporting which must occur as well. And that's really tight. And the decision around the risk management plan will dictate how often and when these reports must occur. And there's also an understanding of new data which may arise, because we know when clinical trials or certain trials may be finishing, so we can get some of the data. What else happens is there's this continuous review of the international literature, various safety databases and regulatory decisions, all feeding into our decision making to try not to miss signals, that new signals that may emanate from other environments, to continue within the life cycle to assess the risk benefit of the medicine. And then importantly is the causality assessment. And I'm telling you, causality assessment is very difficult. One thinks it's quite simple. Somebody's taken something and they develop a so-called adverse event, and so it must be caused by that. I'm going to tell you now that is actually not the case. Causality assessment is very hard. You need to get a group of people around the table and to really go through the clinical case and make sure that the probability is high that the medicine was the only suspect that may have caused this event to occur in a particular patient. And remember, patients or people that have comorbidities, they may be taking something else, they may have eaten something, for example, be exposed to something else as well. All of these must be taken into account and in terms of narrowing it down to say that this was definitely due to the medicine. And so just because something happened in a patient and whatever that adverse event may be, it doesn't mean to say it's causal. There may be another factor which has in fact caused that harm to occur. And then obviously a critical issue is to promote and to encourage people to report these adverse events, because without the reporting, one can't fill in the gaps and see the bigger picture. So reporting allows people to see a constellation of symptoms that may have arisen in a group of patients, do causality and say, well, we think this is actually due to the medicine, or we think it's actually not due to the medicine, it's due to something else. And then iteratively inform healthcare professionals and the public around new safety issues, not to scare, not to frighten, but to keep people abreast of some of the aspects so they can identify if this may or may not happen to them. So the risk management plan, as I've suggested, is this mitigation strategy, and it's in collaboration. In this situation with vaccines, it's in collaboration. SAHPRA ourselves, the National Department of Health have a role, and the manufacturer. Then there's the group which will be spoken about soon, the adverse events following immunization, which are obviously they are notifiable. And what that means is that you are accountable. You must report an adverse event following immunization. So that feeds into a group of colleagues who are dedicated to review those adverse events and feed back into the regulator. And then training the healthcare professionals and the public around vaccine safety and the issues around reporting, and making sure that they report, no matter what they think, is actually just to report that, so one can look at the number and decide to do causality or not on a particular signal. So the risk management plan is very important, and there's a collaboration around that. Everybody becomes accountable in the safety aspects of a medicine. It's not just the regulator alone. The healthcare professional and Mr. and Mrs. Public need to feed back in the information to allow proper causality to occur. In these collaboration strategies, the National Department of Health, media engagements, training of healthcare professionals and colleagues, keeping the drumbeat going around safety, to have immunization safety expert committees who deal with immunization and the problems that arise with immunization, to be able to lend their voice and to provide insights into a particular event that may have occurred. Also, what's important is we're an active member of the WHO Program for International Drug Monitoring, so we are receiving and providing information into an international program. And then, which has been very exciting, is the African Union, which have developed the Smart Safety Surveillance Initiative, AU3S, and meet on a regular basis, sharing information, especially in this situation, on vaccine safety. Hopefully, widening the net and closing the holes of the net, so we are able to capture information and again review it and make a decision if the risks change. And then reliance with other regulatory authorities to understand what decision they're making, what new information they may have, which has created a differential in the risk benefit of a medicine or a vaccine. So in conclusion, monitoring the safety of vaccines is a critical priority for SAHPRA, all vaccines, and in particular in this situation, COVID-19. We're always looking at our pharmacovigilance activities to make sure we meet this important outcome, share the burden a bit in terms of collaboration, accountability, make sure we're aligning with our partners so we're able to achieve information as quickly as possible to be able to do those reviews. Obviously, trying to communicate as efficiently as possible safety findings without scaring Mr. and Mrs. Public. It's very important to not to scare when one is sharing, and then obviously collaborating is critical, so we can timelessly review any safety issues and share that information. Thank you very much for the opportunity. I look forward to the questions.
Thank you so much, Prof. Mark. I'll still encourage the participants to continue flooding the questions in the Q&A. We'll let the last panelist speak, and then we'll go on to the questions. Now, the next panelist is going to be Prof. Meyer. She'll speak to the review, assessment for causality, and feedback later. Over to you, Prof. Meyer.
Good morning. Sorry, let me just get can you see my screen?
Yes, you may want to put it on presentation mode.
Okay, let me just see what's going on here now. You see my notes page now, no? Oh. I don't know what happened now. Oh my goodness.
If you may want to stop sharing and then maybe reshare again.
It worked just now. Let me stop sharing and share again. Okay. It's like I can't swap from the one to the other. I don't know why. Hang on. Does I? Are you seeing the full screen now?
Yes, that's
right. Yes, we are.
Okay, good. Thank you. Sorry about that one. Okay, so I just like to start and emphasize the fact that side effects and adverse events are not the same. So you've already heard it from some of the speakers, but just to emphasize that it's very important that we understand that. Okay, so if we, like you've heard now, SAHPRA is there to make sure that all the vaccines and medicines that we receive here in South Africa are safe, they are effective, and they are of good quality. So they have expert committees who scrutinize the clinical trial data. So by the time the vaccine or the drug is then registered or authorized for use, we are aware of all the side effects that they detected within the clinical trials. So they are the ones that we can now expect. They occur at a certain frequency. They're usually mild or moderate, and they resolve within a few days of vaccination. And these ones are listed in the product information. So the piece of paper that you would normally get from your tablets or capsules that you buy at the pharmacy. So, but now when we are using the vaccine amongst the public, it's very important that we monitor the safety of the vaccine, which is what you have heard now from Mark as well as from Flora. Now, vaccine side effects, or what we would call adverse reactions, are expected, as I said. So they occur at a certain frequency. And as you can see here on this table, so I've just shown you the for the Pfizer vaccine as well as for the Janssen vaccine. And they also occur in terms of intensity, and they can then be classified into minor reactions and severe reactions. Now, usually the very common and the frequent adverse reactions or the side effects are usually the minor reactions. Not to say that a minor reaction cannot become a severe reaction. That is also possible. But on average, you know, the very common and the common ones are mild, minor, and they disappear within the first 1 to 3 days. And as I said, those are the ones that we expect to see. So like a fever, headache, body aches, and so forth. And as you can see, the very common ones, they appear in one, you know, more than 1 in 10 people. So it could be 1, it could be 3, it could be 5, it could be 7. Now, if we look at the rare events and the very rare events, they, as you can see here, if we imagine this is 10,000 people, and between 1 and 10 people of the 10,000 would probably then experience a rare event. Very rare events would be less than 1 person in 10,000 people. The adverse reactions that you see here on the screen in green are the ones that they have identified after the registration and authorization of the vaccines. In other words, when we started to give the vaccines to millions of people. So that's why, because they are very rare, it's not possible to detect them while the clinical trials are still ongoing. And then these adverse reactions are then included in the product information. So just to summarize this, so we often talk about vaccine side effects, and then people also call them adverse events, but they, as I said, they're not interchangeably. They are not the same. So we can rather think about common, mild vaccine side effects here on the left-hand side, versus then on the right-hand side, where we have our more severe, medically significant adverse reactions. So we can think of it as in like a kind of a spectrum going from the one hand to the other hand. So when we look at these mild vaccine side effects, they are, as I said, expected. They're expected because it's the body's immune response. So it's showing that your body is actually preparing for when you would be exposed to the real virus, and your body would then be ready. So it's working to get ready. On the other hand, these more severe adverse reactions, so we call them adverse reactions because we don't expect to see them. They are very rare. They appear in 1 in 100,000 or 1 in a million people. And that actually shows that there's a problem with the body's response to the vaccine. And that is why you then experience these kind of symptoms that you don't want and that you didn't expect. So we spoke about the side effects now and the adverse reactions. So what is then an adverse event following immunization? So what an adverse event following immunization is any untoward medical event which follows vaccination. And as you can see on the right, it could be a sign, it could be a symptom, it could be a laboratory finding, or it could be a disease. But what is very important is that it follows vaccination or immunization. So there is a temporal relationship, but it has not been proven to have a causal relationship with the usage of the vaccine. So that is why we need to investigate whether there is actually a causal relationship. So that's a difference between a side effect and an adverse event. Now, if you look at the adverse events, there is a cause and effect relationship. If we look at a cause and effect relationship, and we know it's between a causative factor on the left-hand side, the vaccine, and then the outcome, the adverse event. So firstly, these two are temporally associated, meaning that the vaccination preceded the event, so it happened before the event. So secondly, there should be no other factors intervening in the process, as Professor Blockman has also alluded to. So events that are temporally associated may not necessarily be causally associated. And that's why it's so important that we are able then to do these causality assessment. So, but I mean, we are all human beings, and it's human nature to blame things on a single major cause. So we often make the mistake of blaming something that occurred earlier. So we then we make an error of reasoning, which we call a logical fallacy, where we then assume that one event must be the cause of a later event for the simple reason that it occurred earlier on. And this kind of logical fallacies, they are the basis of so many, superstitions that were believed in the olden days. And also today, especially now with COVID-19, all the misinformation that is flooding social media that we've seen since the COVID-19 pandemic. I mean, it has been happening for many years, but it's really become worse with the COVID-19 pandemic, and then together with that, the rollout of the vaccines. So with the COVID-19 vaccine introduction, in addition then to adverse events following immunization, we also have adverse events of special interest that we need to monitor. Now, an adverse event of special interest, or an AEFI as we refer to it, is a pre-specified medical event that has the potential to be linked. So it's not to say it is causally linked, it has the potential to be linked to a specific vaccine product, for example, anaphylaxis. So it could be serious events related to a vaccine immunogenicity, or it could be events that are potentially specific to special populations, like a young population or a population with a certain condition. So now these events are shortlisted by global authorities, such as the World Health Organization, and they use the Brighton collaboration definitions, and they must be carefully monitored through active surveillance. And this happens now once we've rolled out the vaccine. Then the incidence of these AEFIs for the COVID-19 vaccinated population is then compared to the unvaccinated population, so that we can see whether there is actually, a difference in the frequency that these events are, now appearing in the normal population. And then there could be a need for further investigation. So if you look at this is just a list of these AEFIs at the moment, and they are constantly being updated. So what is very important, as I said, with the vaccine surveillance, active surveillance, is that if something is now being identified and the adverse event is then, so we investigated, or the authorities, depending on what happened, will be investigating it, they will do a causality assessment. If a positive causal association has then been identified between an adverse event and a vaccine, and it's confirmed, then that would be classified as an adverse reaction. And thereafter, they will look at the benefit-risk ratio, And if they find that this still remains positive, it will be included in the product information because it wasn't previously known as a side effect or an adverse reaction. So an example of that could be Guillain-Barré syndrome or anaphylaxis and so on. And that would then be included in the product information in terms of updating. So what happens then when we get the vaccine? What can we expect? So as I said, we are aware of the common side effects. So those are the mild, the moderate ones that people can expect. They're usually self-limiting. You can take something for it and you can rest, you make sure you are dehydrated, and you can manage those, on your own. But then if there's anything of medical concern, that's very important then to seek medical help and care and report this adverse event. So as the previous speakers alluded to, you can either go to the health facility. I mean, when you need medical care, you need to go to a health facility. You can report with the Med Safety app, as well as there's a hotline. So what I want to emphasize is, again, by reporting side effects and adverse reactions and adverse events, you can help provide more information about the safety of the vaccines. Because all this information is now being used to make sure that the vaccines stay safe. So the aim of the reporting, as Professor Blockman has also said then, is to be able to do a causality assessment. So before that's done, these cases must be investigated properly and all this information must be collected. And then there are expert committees who will then look at these cases, discuss, everything about the case, look at all the information available, and then they will make a decision, if it's possible, about whether the vaccine is then linked to the adverse event. So it's very important that we shouldn't assume that these events are due to the vaccine. So when we look at the causality assessment, we make sure that all the information is available. We look at whether there's any evidence for other causes. So we look at the person's medical history. We also consider whether there is a known causal association already with the vaccine and the event. So we look at all the literature, all the data, published, unpublished data. We also look at whether this event actually happened after vaccination and within a specific time window. We look then at whether there's any evidence against a causal association, like, for example, blood tests, autopsy reports, post-mortems, and then whether there are any other factors that must be considered, like what kind of medication the person is taking. You've heard about how many adverse drug reactions there are to medication, specifically as well, or then allergies. So finally, in conclusion, we need to consider what are the real benefits of vaccination and risks that we should be concerned about. So firstly, we need to consider what are the risks of rare adverse events. And as I've shown you, these risks are really very extremely small compared to the huge risk of contracting COVID-19 disease, being faced with hospitalization, complications, possibly death, and if you survive long COVID. Also important to remember that the vaccines are actually there to protect us against certain events, as you can see here on this infographic. So it protects you against certain effects or events that you may actually get as a result of COVID-19 itself. But then the vaccine would then also have some of these very rare events, and you need to weigh those up against one another. So thank you very much. Just some recognition to everybody who's been involved in making sure that we monitor the safety of the vaccines to make sure it's safe for everybody out there to use. Thank you very much.
Right. Thank you so much, Prof. Meyer. They are indeed the questions are coming up in the chat. We are responding to some, the panelists are responding to some of the questions. At this point, I'll pose questions for Marion from the Department of Health. It's two questions that I'll start with. The first one, are vaccines mandatory? And then the second question still linked to that is, why is the uptake of vaccines low? And what is the National Department of Health doing to increase the uptake of COVID-19 vaccines? Over to you.
Okay, thank you. So on the first question, is vaccination mandatory? No. There is some workplaces that have implemented mandatory vaccination policies, and the Department of Labour has set out regulations on how that should be handled. But for the Republic of South Africa, the general public vaccination is not mandatory. And then in terms of vaccine uptake, so within a population, you will always find vaccine eager people that want to get vaccinated. And then you get people that are indecisive, they haven't decided if they want to get the vaccine, and then you get the vaccine hesitant population. So one of the ways that we are addressing poor coverage at the moment and trying to increase uptake of the vaccine is addressing vaccine hesitancy, of which such meetings such as this is one of the ways that we are trying to address vaccine hesitancy. Thanks.
Right. Thank you so much, Marion. I think at this point there's a question that keeps coming up on the recently released document by Pfizer. And I think I'll give an opportunity to the SAHPRA CEO to address that question and the concerns around it. Over to you, Bejimelo.
Thank you so much, Spusiso, and again, thanks to the participants for these very important questions. We're trying as hard as we can to respond to them as they're coming in the chat. In terms of the report that has gone out containing about 1,200 or so adverse events, and as Prof. Mayer has indicated what the difference is between an adverse event as well as a side effect. This is a report that we are still in discussions with Pfizer, the local office that is the applicant in the country on, as well as the FDA, to understand the authenticity of this report, to understand the status of the report. You may have noted also that in some of the news articles, they indicated that there was an intention to suppress the data. So as SAHPRA, we cannot comment on that. As I've said, we are engaging with the FDA and Pfizer on this matter to understand on the report. The other point that was asked was around the contract that it's alleged that it indicates that the VARs cannot be assessed. I must state, quite categorically that for us as a regulator, we consider all elements that speak to a health product safety, quality, and efficacy. So in terms of the vaccines, we have looked at, where are these vaccines manufactured, other facilities where they are manufactured compliant with good manufacturing practices. We've also looked at the manufacturing processes themselves. Are they compliant? And is it a quality product that is being required? So we look at the ingredients contained in there. We look at the vials. We look at every single aspect of this. And then lastly, we look at the efficacy. So as a regulator, we've looked at all these elements. We cannot have a contract that indicates what we can do or what we cannot do. The Medicines Act is very clear on what we need to do as a regulator. Thanks. I'll pause here, Spusiso. I don't know if you want me to ask the follow-up questions to Prof. Mayer, maybe, and then I'll hand back to you.
Yeah, please go ahead.
Thank you. I'm kind of co-moderating in the background with Spusiso, and some other colleagues will also join in. Prof. Mayer, there was a question. I've got 3 questions for you, and we'll continue to look at the others. There was a question around breakthrough infections. Are we monitoring those, and what do those mean in the context of these vaccines? Secondly, there was a question that says that now that there's an understanding of what the difference is between adverse events, and side effects, what are the side effects? of the Pfizer and the J&J vaccine that we have seen in the country. And then lastly, we say that there are side effects, yet in the same sentence, we say that the vaccines are safe. Can we elaborate on that? I'll pause with those three.
Thank you very much. So let me first answer the side effects. Yes, we know there are side effects, and if you look at the tables that I've shown, I mean the common and the mild ones are the ones that we see most often. So they happen between in more than 1 out of 10 people. And they, if I can also answer the question with regards to which kind of side effects are we seeing in South Africa. So we are seeing mostly, most commonly, the ones that's already listed in the product information. And they are also the ones most commonly being reported. So if you go to the microsite of SAHPRA for the adverse events following immunization reporting, you will see that the top 10 adverse events being reported are those. But you need to keep in mind that these are spontaneous reports. So what happens is a person would report something, and then sometimes, they need to go back to those people to find out exactly what have they reported to make sure it was actually, that specific. So say, for instance, someone would report an anaphylactic reaction. It might not necessarily have been an anaphylactic reaction. It might have been just, a normal allergic reaction. So when you look at that kind of data, you have to keep that in mind. So what I can say at this stage is the vaccines are really very safe. In terms of the causality assessment, no deaths have been linked to be caused by the vaccine. And in terms of product-related reactions, I'm speaking under correction, I think we have about 9 cases, which was like a severe reaction to the product. That we have identified. So if you look at how many million doses we have already administered in the country, you can see it's in line with what we see in terms of the product information. Sorry, Tumi, I'm trying to think now. What was the other question?
The other question was, now that we know that there are some side effects, how do we then make a statement that these vaccines are safe?
Yeah, I think I've answered it already. They are safe, and also, why we are also saying they are safe is that they are being monitored, and that's why it's so important for people to report these adverse events. Because if you report a minor event, it means your data contribute towards the overall data that we have available. So why are we doing that? Because we want to monitor. So if we say that, say for instance, fatigue, headache, and nausea, it commonly occurs in between 1 and 5 out of every 10 people. Then we want to make sure what we are seeing in the population is what we have seen in the clinical trials, that there are not certain events that's now being reported more often. And someone also asked about, so now when becomes an adverse event a side effect? So when causality has been linked between the adverse event and the vaccine, that's then when it becomes, and we can confirm that it was definitely caused by the vaccine. That's then when, and we also look at, how many of these cases do occur and what's the background rate if it applies. Then the adverse event would then become a side effect, and it will be included in the product information. Thanks.
All right, thank you. Thank you, Prof. Meyer. I think then the next questions will be directed to Flora. I think the first one is with the app, how do we reach rural populations? That's the first question. And then the second one is, if the public is to report once, is there a unique reference number that is shared with manufacturers? I think those are the two questions, Flora, for you. You can respond.
Okay. Okay, thank you so much. So with regards to the reports being shared with the manufacturers, so currently what we are doing, because of the safety of the concern of the safety of the COVID-19 vaccines, we have been sharing particularly the reports that pertains to the COVID-19 vaccines with specific manufacturers so that they can be aware of the safety profiles or what SAHPRA is actually getting with regards to their products on the market. And maybe I need to also indicate that SAHPRA is in the process of acquiring a system where all the adverse events that have been received via the MedSafety app, they can be shared with the companies, where the companies would specifically go on that particular system and get what is take what is relevant to their product. So at the moment, we don't necessarily have that system, but we are sharing the adverse events following immunization for COVID-19 vaccines with specific manufacturers that are responsible for those vaccines. And then secondly, with regards to the how do we reach the populations in the rural area, I have indicated in the comment section that so all healthcare professionals, they have been provided with training with regards to the use of the MedSafety app during the rollout of the COVID-19 vaccines. So there were several modules that were done by National Department of Health, and these are also still available on the SAHPRA website together with the National Department of Health websites, where we were training healthcare professionals on the use of the MedSafety app. And then furthermore, there has always been a reporting system in place with regards to the use of paper. Just because we are promoting the use of the MedSafety app, it doesn't mean that we don't accept the paper-based forms anymore. So the process of the paper-based forms, it's still continuing. However, we are discouraging that, but we are of the view that as much as we would like to move with the MedSafety app only, maybe in the future, there's still a need for us to consider the rural areas where there might be signal challenges with regards to reporting. Particularly, for instance, when we have webinars like that, they might not even be able to have an opportunity to join. So the reporting through via the paper-based format is still acceptable, where they can go to their healthcare providers in a clinic, be it a medical doctor who may be there, and then they can report via them, and then we will reach that. However, I need to categorically indicate that we are of the view that we are aware that we are not reaching them enough. So we are putting strategies in place where we are planning to do training. But because COVID has been a hindrance with regards to physical contact, then some of the things then we had to put on hold. But we are aware that we are not necessarily doing enough at the moment, but we are in the process of ensuring that we will reach out to them. Thanks.
Right, Paitumelo, do you want to ask the next question?
Yes, please. Thank you for that. There's a lot of questions, so we may not be able to get through to them, but we will try to respond to as many as we possibly can. Prof. Blackman, I've got 4 questions for you, please. The first is, why do we need boosters? The second is that, you know, if a person has generally been prone to getting a flu and so far have not tested positive for COVID, even though they've, you know, gone numerous times to get tested, do they still need to get a vaccine? Because it may seem like they have natural immunity. The third one is, someone says they presented with arrhythmia, and in that case, should they still get a vaccine? And then lastly, you know, why did SAHPRA authorize vaccines for children? If you can speak to that from your medical background also, that would help. Thank you.
Okay, so thank you for that. So I think the reason why the first 2 are quite important. So I think to state up front is that You don't want to get natural infection and get immunity from this virus by being infected. That's number one, because we are not clear really of which patients will develop severe life-threatening disorders and which won't. We also know that natural infection has been shown to wane, unfortunately. So the idea of being infected on a regular basis to maintain your natural infection and your immunity is an inappropriate manner, because it wanes over a period of time and you lose that protection. What we do know is that an element of natural infection and vaccines, which provide longer-term immunity, is the way to go in terms of preventing patients from developing severe life-threatening COVID and death. And so the boosters are required, because not only do we know that natural infection and immunity wanes, but over a period of time, what has been shown is that there is a waning even in vaccine-associated immunity. And so until such time as we have slightly better understanding of the longer-term immunity for COVID-19 vaccines, there is an opportunity that people would need to be boosted. And it may mean that we boost every couple of years in the general, but in people who are immunocompromised or on medicines that reduce their immunity, they may need earlier on boosting, because the medicines are actually reducing the ability for the vaccine to provide the immunity. So the idea that the natural infections immunity wanes and that over a small period of time the vaccines immunity wanes suggests that we need boosting. What we are excited about is the fact that heterologous vaccine, so you have one vaccine and then you use another vaccine, that's been shown to really push up the antibody responses and some of the T-cell responses, which are important in terms of fighting off the virus. And there's a hope that that in fact pushes out your immunity for much longer period of time. And just as people need a booster flu vaccine every year, there may be a requirement, depending on what these antibodies look like, for a booster for COVID-19 as well, for us to safely live with the virus. The issue on the arrhythmia is important, and so for me, just by suggesting that somebody has an arrhythmia, I would need to ask, do we think this arrhythmia is due to post-vaccine, and was it causative? Was the the clinician looking after the patient clear that this was due to the vaccine and there was no other underlying comorbidity? Or are we suggesting that somebody has an arrhythmia and should they be vaccinated? My feeling is that if this arrhythmia is caused by, and it's a arrhythmia which is obviously life-threatening, which is caused by or is proposed to be caused by a vaccine, then one may suggest that getting the same vaccine again as a booster would be problematic. But choosing a vaccine as a booster which does not cause the effects on the heart could be deemed to be safe under the care of the cardiologist, and you make an informed decision. If you have an underlying heart rhythm problem, which is then putting you at risk from getting COVID in terms of the organ already is compromised, then having a vaccine is very important in terms of protection. And there one would look at which vaccine has the better safety profile in affecting the heart, and one would opt for that vaccine to make sure that that patient is adequately protected from COVID-19, because getting COVID and having underlying respiratory or heart disease is problematic from a clinical point of view. The children is important, and the vaccination of the children would be looking holistically at making sure that as best as possible there's a sufficient amount of people within the country which have an immune response to try and prevent the COVID infection. And children have been shown to be great providers of COVID into families, into the school environment. And so protecting the children and hopefully reducing that transmission is deemed to be a reasonable idea in terms of us, again, wanting to live with this virus and to try and open up the economy, protect the healthcare environment from severe disease and people requiring hospitalization. And we keep on looking critically at the safety data, because that's what people are worried about, is that are we clear that this is safe in children? And so the idea would be to make sure that we have looked as quickly as possible and appropriately as possible to the data that's put in front of us within the pediatric population, as well as what is being done by our international collaborators, and come up with a plan with proper monitoring in terms of the vaccination of children. Over. Do you need me to elaborate on anything else?
No, I think you've covered it. Over to Sisi, so thank you.
Okay. Thank you, Prof. Mark. I'll move over to Marion, and some of this you have responded to on the chat, but I'll still ask for the benefit of those that might not have looked at the chat. So one of the questions is on the difference between adverse events following immunization and side effects, and apparently there's a need to explain this, and also how this is reported, and this has been responded somehow on the chat, but if you can still go through this as well. And then there's a related question is by just moved now, but basically it speaks to adverse effects and being reported, and the form that's being used, if it includes all of the minor side effects. Over to you.
So thanks. I'll take question 2 and 3, and then I'll ask Professor Meyer to explain the difference between a side effect and an adverse event. So let me just start. Adverse events can be reported as Flora indicated. We prefer the use of the MedSafety app. The MedSafety app can be used by both the public or vaccinee, a person in the general public, or it can be used by healthcare professionals, and they can also use the MedSafety app. And the MedSafety app then replaces our paper-based case reporting form. On the MedSafety app and on the paper-based case reporting form, under the minor events, the most commonly reported minor events are available there to just select from. But you can report any adverse event if it's not listed there. There's a space where you can indicate whatever event it is, even if it's not listed as part of the most commonly reported ones. Professor Meyer, would you address the side effects and the adverse events question, please?
Thank you. Yes. So maybe I can just before let me first do the side effect and the adverse event. So the side effects are the ones that we already know of. So they have been identified in the clinical trials, and they are contained in the product information. Someone also asked about the product information. Do we have it available? So at the moment, if you want to look at the product information, you can go to the EMA, the European Medical Association evaluator, go to their authority, EMA, European Medical Authority. You can go to their website and they update the product information very quickly. I could say on a weekly basis if any new information become available. So an adverse event is something that needs to be investigated still to determine whether there is a link between the event and the vaccine. For example, in that Pfizer, in the report, you will see people reported, for example, pneumonia, influenza, and pneumonia, measles. So it is an event that happened after vaccination. But I mean, we all know that the COVID vaccine cannot cause pneumonia, measles, because it's completely different virus causing measles as well as influenza. So that is why it's important to read the entire report and understand the report. I saw there were many questions also about the report. So, and whether, you know, SAHPRA would have approved the vaccine if this report was available beforehand. So this is a periodic safety update report. And like Professor Blockman has also explained, that the vaccine manufacturer, they are required to produce these reports continuously. And these reports contain all events that people reported, which is what we want. We want people to report all these events, but then they first must be investigated to determine whether it's really linked to the vaccine or not. So the fact that it's been reported doesn't say it has necessarily been caused or been linked, or it's linked to the vaccine. So yes, if you read the report, you will see that they have not identified any, based on that report, they have not identified any new safety concerns or signals. Thank you. I hope I've answered that question.
Thank you. Just the last one for you, Prof, as we start to wrap up. There's a question around deaths, that we have looked at deaths and yet we say that we haven't seen any causality. Can you maybe again just restate how we do that assessment and how we ended up at this conclusion? Thank you.
Sorry, I hope I got the question right. So you're asking about how the causality is done to be able to get to the conclusion.
Specifically on deaths. On the deaths that have been reported.
Sorry, on the death. All right, okay. So on the deaths that's been reported, so especially in the beginning when the COVID-19 vaccine was just rolled out, it was administered in, as you know, mainly in the elderly population, and many of these deaths have been reported. And many of them were actually due to COVID-19 disease itself or COVID-19 pneumonia. So in that case, how we would then determine is, say for instance, someone has got the vaccine today, and 2 days later they get admitted to hospital with COVID-19 pneumonia, which is then confirmed with a positive SARS-CoV-2 test. It means that the person was already incubating COVID-19 prior to vaccination. And also remember, you would have only mounted enough or sufficient immunity and your immune response after you had the second vaccine. So many of these elderly people, because they are at higher risk and so on, they couldn't mount a sufficient immune response, and then they contracted COVID-19. Also, many of them died because of severe comorbidities that they had. So one needs to remember that COVID-19 vaccine can only prevent you or protect you against COVID-19. It cannot protect you against other diseases. It cannot prevent you from dying of your comorbidities. And that's also why we then look at what are the rates of certain comorbidities and death due to those comorbidities in the country as well as globally, to make sure that we don't see suddenly a rise in death, for example, due to specific comorbidities. But with a causality assessment, we can only come to a conclusion when we have all the information available. So we have some cases that's unclassifiable, meaning there's not enough information available to evaluate whether there is a link between the vaccine and the condition. So we are very, it's a very rigid process that it's going through, considering all medical history, clinical notes, doctors' reports, tests, and so on, before we do come to a causality assessment outcome. Thank you.
Thank you, Prof. Mayor. We are almost 5 minutes before time. I think at this point, it'll be appropriate to request each of the panelists. I will start with Flora, Prof. Mark, Prof. Mayor, then finally Boitumelo, to give your concluding remarks as we come to an end of this webinar. Over to you, Flora.
Okay, thank you so much. I was actually trying to answer some of the questions, hence it took me a little bit of time to come back to the screen. So I'd like to thank everybody who has actually taken time out of their busy schedule to come and attend the webinar. So from my side, I would like to indicate, as I've indicated in my presentation, that reporting of adverse events is very important because it contributes to the greater safety of the medicines globally. So as some of the questions on the chat has actually indicated that there's a low reporting of adverse events in South Africa. And yes, we are aware of that. And then we are doing everything in our power to ensure that we promote reporting of adverse events. So I would urge that those who have the means and the capabilities, they should actually continue to report so as to ensure that we ensure that the safety profiles of our products, particularly the COVID-19 vaccines, because these are new products and their safety are evolving, then you continue to report so that we continue to evaluate the safety profile of this product and ensure that everybody is safe. Thank you so much.
Thank you, Flora. Prof. Mark.
So thank you very much. I'm not going to add too much more to Flora, but to say thank you to everybody for the collaboration, for the questions that we will maintain and make sure that we find the opportunities to answer, but to be clear that it's a collaborative process for vaccine safety and the sharing of information and the causality assessment, which improves our risk-benefit assessment, is of paramount. And we value these communications and these collaborations to provide more insights for us to use for our reviews. So thank you very much.
Thank you. And last, Prof. Mayor.
Yes, from my side as well, I could just emphasize that, you know, the risk-benefit profile of the vaccines remains to be, you know, at an advantage. It is protecting against severe disease, hospitalization, and death. I mean, the evidence is overwhelming. And then for people to make sure they report, yes, the reporting is still very low, and to keep in mind that the reporting is spontaneous. So it means it's been reported, which we want, but it needs to be investigated, and causality must be determined before we can say this has been caused by the vaccine. And then just a last comment to note that while our reporting is low, because of the AEFIs, the African Union Smart Surveillance Program, our data is combined with the data of 4 other countries in Africa. So on a weekly basis, there is a meeting where all the data is collated, and we also look at that data to identify any possible signals. So it's huge numbers of events being reported. So I hope that can also, you know, encourage people. Thank you very much.
All right, thank you, Prof. Mayor. I think I'll give the chair of, I'll give Boitumelo to be the last person the CEO of SAHPRA to be the last person to make comments, and then I think she'll close. But I think from myself, it's been an exciting webinar, a lot of questions coming up. I know that seeing what's happening behind the scenes, the SAHPRA team is really working hard to address all the questions. They may not get to addressing all the questions that have been put on the chat, but I think it's been a good effort, and I think it's a conversation that should continue. And over to you, Boitumelo.
Thank you very much, Swisisa, and thanks for the partnership, you know, with PATH and the various stakeholders here in hosting this webinar. as a regulator, one aspect that we committed to is regular engagement, with the public on these matters. And hence, we have even said that you will see us having more and more of these webinars around these topics. So again, if there's specific topics that you would like us to, deep dive into, you're welcome to contact us through our comms office, and their details are on our website. In terms of the specific topic, I think I will agree with my colleagues that vaccines still remain one of our most effective tools in the management of COVID. They remain to be safe. And yes, like many other medicines, they do have side effects. We are monitoring those on a periodic basis. Hence, these reports that Prof. Blackman spoke about, that we as a regulator get from the applicants on a regular basis. I'd also like to urge the public to just go to your medicine cabinet and look at a medicine that probably most of us have, like a paracetamol, Calpol. Take out the leaflet and see what information is contained in there. We know that paracetamol is a safe medication. However, similarly, it does have side effects. That's why you have to take specific doses. It has to be monitored, etc. Also look at another vaccine that most of us who have children, maybe between the ages of 6 and 7, you would take them for an MMR vaccine. Have a look at the leaflet. You can find the leaflet, the product information even on the website. So as regulators, we're very transparent about what we consider adverse events, about what we consider side effects, and we communicate these to the public. And not only to the public, it's important that the healthcare practitioners are also aware of those, so that they then know how to manage you as a patient. So please do that simple exercise. It will be very enlightening to you as the public to note what type of information is made available. Similar information is available on all the COVID vaccines. If you visit our website, if you visit the website of all the regulators, you will find this product information contained in there, because again, in an effort to be transparent and to communicate to the public. And then lastly, I would like to just urge the public again to say vaccines are safe. They are our most effective tool, and we do encourage you to go and get vaccinated for COVID-19. Thank you so much for your time, and this was a very fruitful discussion. Thanks, Mr.
Thank you, and that brings us to the end. Have a good day.